Study Session 12. Pain and Pain Management. Introduction. Pain is an unpleasant experience which one tries to avoid or do something about, such as taking painkillers, seeking medical help, or avoiding movements or positions that bring about pain or make it worse. We all experience pain to a greater or lesser degree at various points of our lives. Each person perceives pain differently, and as a result, each person also responds to painful stimulations differently. For instance, children are quicker to cry after a relatively minor injury than the adults. Pain is highly subjective to the individual experiencing it. It is part of the body's defense system, triggering a reflex reaction to retract from a painful stimulus and helps us to adjust behavior to increase avoidance of that particular harmful situation in the future. Given its significance, physical pain is linked to various biological, sociocultural, and psychological issues. Hence, it can be managed physically and psychosocially. Therefore, in this study session, we shall discuss the concept or nature of pain, its causes, types, and how it can be effectively managed by the medical social workers. Learning outcomes. When you have studied this session, you should be able to explain the concept of pain as stated by Turk et al. 1983. List different causes of pain. Highlight different types of pain and their symptoms, and state the management stages of pain. The concept of pain. To understand what pain actually is, you have to know what different authors have stated about it. Thus, pain can be defined as an unpleasant sensory and emotional experience caused by real or potential injury or damage to the body. According to Turk et al. 1983, pain is the most universal form of stress. It is usually experienced as an unwanted physical stimulus located in a specific organ or anatomical region of the body. Brannon and Feist, 1997. It is a direct consequence of physical injury or a person's reaction to sensations. Pain can have different sensory qualities, such as shooting, burning or throbbing pain, or it can be a dull ache that is just annoying enough to distract us from what we want to do. Baum et al. 1997. Stages of pain. Pain is not a single entity, but can be seen according to various stages and types. Keefe, 1982, has identified 3 stages of pain, namely acute, prechronic, and chronic stages. Each stage is associated with a particular pain. Hence, acute stage is associated with acute pain, prechronic stage with prechronic pain, and chronic stage with chronic pain. Acute pain. Acute pain is ordinarily adaptive. It signals to the person to avoid further injury. It is a kind of pain that comes and goes relatively quickly in about 2 weeks or less. It usually lasts less than 6 months. It includes pains from cuts, burns, surgery, dental work, childbirth, and injuries. 2. Prechronic pain. This is experienced between the acute and chronic stages. This period is critical because the person either overcomes the pain at this time or develops feelings of helplessness that lead to chronic pain. 3. Chronic pain. This is the type of pain that endures beyond the time of healing. It is more or less constant and is often self-perpetuating. That is, it frequently leads to behavior that is designed to elicit reward and comfort. It is frequently experienced in the absence of any detectable tissue damage. Types of pain. Turk et al. 1983 classified pain into 5 types. These are 1. Acute pain. 2. Chronic recurrent pain. 3. Chronic interactable benign pain. 4. Chronic progressive pain. And 5. Experimentally induced pain. 1. Acute pain, which is of a sudden onset and characterized by sharp pains. 2. Chronic recurrent pain is characterized by intense episodes of pain interspersed with the periods of no pain. Example: this is a migraine headache. 3. Chronic interactable benign pain is a pain that is always present but not always severe. Example: low back pain. 4. Chronic progressive pain is omnipresent pain that gets stronger as the medical condition worsens. It is frequently associated with rheumatoid arthritis and cancer. 5. Experimentally induced pain. It usually consists of electric shock, radiant heat, cold water immersion, or pressure administered in the laboratory setting to voluntary participants with no previous pain problems. According to Brannon and Feist, 1997, pain can also be categorized according to location or syndromes. Hence, we have pain conditions or syndromes such as headache, low back pain, myofascial, arthritis, cancer, or phantom limb pain. 1. Headache pain. The most common forms of headache pain are migraine, tension, and cluster headache. A. Migraine headache. This is common among women. It is characterized by recurrent pain attack on one side of the head, loss of appetite, vomiting, and mood disturbance. The pain is high in intensity, frequency, and duration. B. Tension headache. This is muscular in origin. It is contraction of the muscle of the neck, shoulder, scalp, and the face. There is sensation of tightness with steady ache on both sides of the head. It is high in intensity, frequency, and duration. C. Cluster headache. This is a severe form of headache which occurs daily in clusters for 4 to 16 weeks. Pierce, 1994. It is characterized by severe pain and vomiting. The headache may not last longer than 2 hours. It is located on one side of the head, and often the eye on the other side becomes bloodshot and waters. The headache is more common in men than women, with a ratio of 10 to 1. It occurs every year or 2. 2. Lower back pain. This type of pain is caused by infections, degenerative diseases, malignancies, injuries, stress, or job-related activities resulting into musculoskeletal and neurological disorders in the low back. 3. Arthritis pain. This simply means joint inflammation. Rheumatoid arthritis is an autoimmune disorder characterized by swelling and inflammation of the joints, as well as destruction of cartilage, bone, and tendon. These affect the joints, producing direct pain and changes in joint structure and movement. 4. Cancer pain. This is a type of pain caused by any malignant neoplasm or as a consequence of therapeutic intervention for the disease or both. Example, X-ray or radiology. 5. Phantom limb pain. This refers to pain after limb amputation. That is, the experience of chronic pain in the absence of body parts. Loser, 1990. It is characterized by feeling of shooting, cramping, burning, or crushing pain. 6. Myofascial pain. This is the most common type of chronic pain. According to Shola and Bonica, 1990, myofascial pain is a large group of muscle disorders characterized by extremely sensitive trigger points within the muscle or connective tissue. It is experienced as a continual dull ache in nearly any part of the body, but the most common parts are the lower back, shoulders, neck, and head. Myofascial pain can result from sustained muscle contraction, muscle trauma, and muscle weakness. Management of pain. For centuries, physicians have used a variety of means for alleviating pains. However, many of these procedures are now supplemented by psychological or behavioral procedures. Therefore, pain could be managed medically and psychologically. 1. Medical treatment of pain. This consists of drugs, surgery, and acupuncture. A. Drugs. Analgesic drugs, that is, pain-relieving drugs, are very effective in managing pain of various sorts. They relieve pains without causing any loss of consciousness. The two major groups of drugs that are commonly used are the aspirin type and the opium type. Examples of these are aspirin, acetaminophen, morphine, and so on. B. Surgery. This is the most extreme form of treatment for pain and is usually used only when other treatments have failed. The most common use of surgery is to alleviate chronic low back pain. C. Acupuncture. This is an ancient Chinese form of analgesia. It consists of inserting a needle into specific points on the skin and continuously stimulating the needle. This treatment for pain relief remains an experimental therapy, as existing literature does not give conclusive reports of its effectiveness. 2. Psychosocial treatments. These consist of psychological procedures and social support. A. Hypnosis. This is the oldest treatment for pain. It was used in the early 19th century as an analgesia during surgery. Hilgard and Hilgard, 1975. According to Hilgard and Hilgard 1975, hypnosis is an altered state of consciousness in which a person's stream of consciousness is divided or dissociated. To them, the process of induction, that is, being placed into a hypnotic state, is central to hypnosis. After induction, the responsive person enters a state of divided or dissociated consciousness that is essentially different from the normal state. This altered state of consciousness allows people to respond to suggestions and to control physiological processes that they cannot in the normal state of consciousness. Hilgard 1975 and Barber 1980 agreed that hypnosis, or the hypnosuggestive procedure, is an important clinical tool, especially for the control of pain. The list of pains that are responsive to hypnotic procedure include childbirth pain, headache pain, cancer pain, low back pain, myofascial pain, and laboratory-induced pain. B. Progressive muscle relaxation. This is only one of the several types of relaxation techniques. With progressive muscle relaxation, patients are first given a rationale for the procedure, including an explanation that their present tension is mostly a physical state resulting from tense muscles. The patients are asked to be in a comfortable chair, instructed to breathe deeply and exhale slowly. After this, they are instructed to tense a particular muscle group. Example, hand, leg muscles, etc., and to hold the tension for about 10 seconds. They repeat this exercise several times, and once they learn the relaxation technique, they may practice independently at home. C. Meditation relaxation. This approach was derived from various religious meditative practices. However, as used by psychologists, it has no religious connotations. It was developed by Benson et al. 1974. This approach combines muscle relation with a quiet environment, comfortable position, a repetitive sound, and a passive attitude. Participants usually sit with eyes closed and muscles relaxed. They then focus attention on their breathing and repeat silently a sound like or one with each breath for about 20 minutes. Meditation involves conscious intention to focus attention on a single thought or image, along with effort not to be distracted by other thoughts. Guided imagery. With guided imagery, patients conjure up a calm, peaceful image, such as the repetitive rhythmic roar of an ocean or the quiet beauty of a pastoral scene. Patients then concentrate on that image for the duration of a painful or anxiety-filled situation. The assumption underlying guided imagery is that a person cannot concentrate on more than one thing at a time. Therefore, the patient must imagine an especially powerful or delightful scene which can avert attention from the painful experience. However, it should be noted that some forms of guided imagery do not involve pleasant images. Example, unpleasant situations like embarrassing childhood experience, the death of a friend, etc. whether pleasant or unpleasant, must be sufficiently intense to block any feeling of pain. Another form of guided imagery is called in vivo imagery, in which the patient is asked to concentrate on real-life situations. The patient may be asked to recall experiences that have contributed to their feelings. Example: pride, self-esteem, self-assertion, etc. By concentrating on these images, the patient is able to cope with the pain by inhibiting most of its unpleasant effects. E. Social support. This refers to a variety of material and emotional supports a person receives from others. It includes such things as perceived emotional concern from others, health-related advice and information, material aid, self-enhancing words, and behaviors received from others, and many other factors. Brannon and Feist, 1997. Social support has been linked with stress and chronic pain. Some people react better than others to stress and chronic pain. There are those who have greater personal resources for coping. One of the most beneficial personal resources appears to be social support from family members, friends, and healthcare givers. Therefore, when adequate social support, example, financial, material, and other support, is given to those in painful conditions, they may experience some degrees of relief from such pains. Study session summary. In this study session, you learned that there are various strategies that can be employed to manage pains. Pains can be managed medically or psychologically. Its medical management includes use of drugs, surgery, and acupuncture. Psychological pains can be managed through hypnosis, relaxation, breathing exercises, and social support. End of study session 12. Thanks for listening.